Good evening, class. Tonight we'll be going over chapters 7, 8, 9, and 10, which include anatomy and physiology of pregnancy, nursing care of the family child during pregnancy, maternal and fetal nutrition, and the assessment of high-risk pregnancy. We'll be starting with chapter 7, anatomy and physiology of pregnancy. So understanding the following terms is essential to the study of maternity care. I'm sure you've heard some of these in report if you've already done some of your clinical rotations with labor and delivery. So gravida is a woman who is pregnant. Gravidity is pregnancy. We don't use that word a lot. Nulla gravida is a woman who has never been pregnant. Prima gravida, or primip, is what you've probably heard, is a woman that's pregnant for the first time. And multigravida, or a multip, is something you may have heard in report, is a woman who has had 2 or more pregnancies. Parity is the number of pregnancies in which fetus or fetuses have been delivered at beyond the age of viability. Nullipary, excuse me, is a woman who has not completed a pregnancy with fetuses or fetuses who have reached the stage of fetal viability. Primipara, or primip for short, is a woman who has completed 1 pregnancy with a fetus or fetuses who have reached a stage of fetal viability. Multipara is a woman who has completed 2 or more pregnancies to the stage of fetal viability. Term. Preterm is when the pregnancy has reached 24 weeks of gestation, but has not completed the 37th week of gestation. So between 24 and 37 weeks. Late term is pregnancy that has reached between 34 weeks and 0 days and 36 and 6 days gestation. So late preterm is after 34 weeks and before 36 weeks and 6 days. Early term is a pregnancy that has reached between 37 weeks and 0 days and 38 weeks and 6 days gestation. Full term is when pregnancy has reached between 39 weeks and 0 days and 40 weeks and 6 days. So 39 and 0 to 40 and 6. Late term is a pregnancy that has reached between 41 weeks, so they're already past term, 41 weeks and 0 days to 41 weeks and 6 days. Once they hit the 41 weeks and 7 days, which is 42 weeks, they're called post-term pregnancies. No one ever gets that far unless they are denying the doctor's recommendations. With some patients that come in that are natural, that want to wait, may get to this, but that's too dangerous to get to 42 weeks. As the baby is grown, is larger, may have more complications. Viability is the capacity to live outside the uterus, happens about 22 to 25 weeks gestation, and are on the about 22 to 25 weeks gestations are on the threshold of viability. There are very premature infants that are vulnerable. They are all vulnerable to brain injuries. So summarizing what we talked about earlier, the gravida, the para, the 2 digits that you will see, G's and P's. So you'll see like a G4, P2. 5 digits that they use is the gravidity, the term, the preterm, abortions, and living child. So it'll be say G4, P3, 0 for the T, 1 for the abortions, and then the living children they have is 3. A lot of times in the hospital, though, we see the G's and the P's, or when you're given a report, you're like 36 and 3, she's a G4, P3. You may not see the terms abortions and living child. You'll see that on the prenatal records and sometimes in some of the charts. Many different pregnancies tests are available. So we have the ELISA, enzyme-linked immunosorbent assay, is a test is most popular method of testing for pregnancy. It's based on most over-the-counter home pregnancy test, and medication use, hormone-based tumors, or improper collection can cause inaccurate results of this test. This is just a picture of all of the over-the-counter tests that you will see. Signs of pregnancy: presumptive, probable, positive. Presumptives is those changes felt by the woman. Probable is changes observed by the examiner. And positive are signs attributed only to the presence of a fetus. Reproductive systems and breasts: the uterus, changes in size, shape, and position, changes in contractility, the uteroplacental blood flow, there'll be cervical changes, changes related to the presence of the fetus, such as ballottement and quickening, and the vagina vulval changes, could be the leukorrhea. Here's an image showing a woman that's weeks gestation. So at 12 weeks, it's very low in the pelvis. 16 weeks, 20 weeks, you see the umbilicus that's between the 20 weeks and the 24 weeks. And then you see up at 36 weeks, pretty close under the ribs, and drops a little at 40 weeks. There may be a question about the height of the umbilicus. Here is a side view of 4 months pregnant, 6 months pregnant, 9 months pregnant. You can see how your organs will move around as the baby gets larger. See how you can see the ribs and how they look much less inflated at the 9 months. And then there's a front on view. And you can see how a woman can be very uncomfortable while she's pregnant. Here is bimanual palpitation. So she's checking the fundal height. Here's the body of the uterus, the mucus plug, and the body of the uterus. There's the cervix right here. Here's also the top. I don't know if you can see my pen. You probably can't. I just realized that. So the top, A, you can see where the cervix opening is, and the bottom, you can see where the cervix opening is, and you can also see where the mucus plug. You can lose the mucus plug. It can come back. Just because you lost the mucus plug does not mean you're going to go into labor right now. That is a large misconception. Here's the bladder on page 1. Let's see if I have a pointer. Okay, it'll show me the pointer. So there's the pubic symphysis, the urethra, the tip of the coccyx, the internal os, and the bladder right here. Now look at the bladder. It's flattened up here, and you wonder why women that are pregnant have to use the restroom more often. No, this is as the cervix has already hit 10 centimeters, and the baby is actually coming out. So the internal os is here, that was here. She is thinned out, and her cervix is a 10. And then here's, you can see where the urethra is. Adaptations to pregnancy. Breast become full and heavy. the heightened sensitivity from tingling to a sharp pain. The areola may become more pigmented, and Montgomery glands as well as a colostrum starts to occur. General body systems, cardiovascular system, the blood pressure, laying flat. A pregnant woman should never lay flat on her belly. If she's going to lay back and she's had her epidural, you're going to put one of her hips up because you do not want her laying on her supravena cava and cutting off her circulation and causing problems. So, supine hypotension syndrome. Never lay flat on your back when you're pregnant. Blood volume and composition increases by 40 to 50%. When you're pregnant, cardiac output increases, so the circulation and coagulation times increase in various clotting factors. Here's showing the some of the stretch marks that happen that can or cannot happen with pregnancy. I don't know why they put this picture up here. Just showing the adaptations to pregnancy. So general body systems, respiratory system, the pulmonary functions, the beta-metabolic rate changes, the renal system, anatomic changes, functional changes, and there could be a fluid and electrolyte should still be balanced. Integumentary system, so the mask of pregnancy, chilazma, linea nigra, is the dark line that you can see on some pregnant women below the belly button and down. Striae gravidarum is the stretch marks. Angiomas are benign overgrowths of capillaries. Palmar erythema is due to increased estrogen. The musculoskeletal changes in neurological system. Here is a picture of diastasis recti, which can happen with pregnancy. So you see the muscles on here. Let me go here. There. There. The muscles are normal here and they are detached here. Sometimes the stomach, as you're laying down, you may see someone as they're laying down kind of have a pooch that comes up in the middle and kind of like a line down their stomach. May have diastasis recti. Here's the usual position of the appendix right here. And when the fundal height grows, the appendix position changes. So here's 3, 4, 5, 6, 7, 8. So the appendix is up pretty high once they're at 8 weeks gestation. 8 months gestation. General body system, so the gastrointestinal system, appetite can change. Some women develop pica, which is, I would just attribute it to, say, I don't think ice may be on there. Eating really different things like clay, mouth and teeth changes, esophagus, stomach, intestines, gallbladder, liver, and abdominal discomfort. Endocrine system significantly increased as progesterone levels to maintain the pregnancy. Now we are going to go to chapter 8. Okay, chapter 8 is the nursing care of the family during pregnancy. So the prenatal period is the period of physical and psychological preparation for birth and parenthood. Opportunities for nurses and members of the healthcare team to influence family care. Healthy women seek care and guidance, and health promotion interventions can affect the well-being of the woman, the child, and the rest of the family. Pregnancy spans 9 months, 10 lunar months, and 28 days, a total of 280 days. Trimesters, the first trimester is between week 1 and 13. Second trimester is week 14 through 27, and the third trimester is week 28 through 40. Estimating the date of birth, formulas of calculating the estimated date of birth, but none are infallible. Nagel rule: determine the first day of the last menstrual period, subtract 3 months, add 7 days in a year. So if you have August 20th, subtract 3 months, so that would be May, add 7 days, so August 20th minus 3 months is May 20th, add 7 days, that'll be May 27th, and if you're in 2020, you're going to add a year to 2021. Alternately, you can add 7 days to the last menstrual period and count forward to 9 months. Usually we use the first day of last period minus 3 months, add 7 days in a year. Most women will give birth within 7 days before or after the estimated date of birth. Paternal adaptation starts with accepting the pregnancy. There's 3 phases: identifying the father's role, reordering personal relationships, establishing relationships with a relationship with the fetus, and preparing for childbirth. Non-pregnant partner adaptation. The partner could be a same-sex couple, could be the non-biological father. Sibling adaptations, needs and responses depend on the age. And then there's grandparent adaptation. Here's a picture of a child being involved in listening to her brother or sister. Here's another picture of a child with the little baby dolls, maybe learning how to take care of his brother or sister that's coming. Care management is the goal of a prenatal care is to promote the health and well-being of the pregnant woman, the fetus, the newborn, and the family. Emphasis is on preventative care and optimal self-care, and prenatal care is sought routinely by women of middle or high socioeconomic statuses. Care management continued. Women in poverty or lacking health insurance may not have access to public or private care. So women in poverty or lacking health insurance may not have access to public or private care. Lack of culturally sensitive care and communication interferes with access to care. Immigrant women may not seek prenatal care. Birth outcomes are less positive and higher rates of maternal and newborn complications can occur. Problems with low birth rate and infant mortality associated with inadequate prenatal care. Barriers to obtaining prenatal care include lack of motivation to seek care, inadequate finances, lack of transportation, unpleasant clinic personnel, unpleasant facilities or procedures, inconvenience of clinic hours, problems with childcare, personal or even cultural attitudes. Effectiveness of home visiting by nurses during pregnancy has been validated, so a current model of prenatal care is used for more than a century. Research supports a model of fewer visits for women at low risk for complications. Also, there's group prenatal care, such as centering classes. I know local women's care center provides centering classes. I'm sure the other large OBGYNs do as well. On the initial visit, the prenatal interview occurs. There'll be reason for seeking care about her current pregnancy, possibly the last menstrual period, obstetrics and gynecological history, her health history, a nutritional history, and history of drug use or herbal supplements. Follow-up visits will include an interview, a physical exam, a fetal assessment of the fundal height, fetal heart rate, gestational age, and her overall health status. Here's a doctor, nurse practitioner, physician assistant or midwife that is checking the fundal height on this patient. Here's 3 different ways. I have never seen A or C, that may be before my time, of checking the fetal heart rate. Follow-up visits continued will be the fetal assessment, could be laboratory testing, a clean catch urine, multiple markers or triple screen blood test. Other blood tests include RPR, VDRL, CBC, and anti-RH. Other tests that can be performed are ultrasound, amniocentesis, and they check for group beta strep between weeks 35 and 37 gestation. Nursing interventions include education about maternal fetal changes, education for self-management such as nutrition, personal hygiene, prevention of UTIs, Kegel exercises, preparation for breastfeeding newborns, and dental health. Here's one way a mother may lay with the pillows, all adjusted to be comfortable while she's pregnant. There's also some really cool pillows that are kind of like a big U shape that they can use. Nursing interventions continued, education on self-management such as physical activity, posture and body mechanics, rest and relaxation, employment, clothing, travel, and medications and herbal preparations. Nursing interventions continued, education or for self-management, immunizations, RH immunoglobulin, substance abuse. Want to make sure that the parent is not participated in alcohol, tobacco, caffeine, marijuana, cocaine, or opiates. Education self-management continued, so normal discomforts could include the feeling of stretching of the muscles as the baby is growing and as your body is adapting, recognizing potential complications, bleeding. Bleeding is not normal during pregnancy. There could be due to placenta previa. It could be due to other conditions. Sexual counseling, learning about their sexual history, countering any misinformation, which is important, like not drinking castor oil. All it's going to do is give you diarrhea and cause you to have horrible contractions for no reason. If your body is not ready for your cervix to change, then you're not going to have your baby. True labor is defined by cervical change. Doesn't matter if you're contracting for 48 hours. If your cervix hasn't changed, you're not in labor. Psychological support and cultural influences such as emotional response, clothing, physical activity and rest, sexual activity, and diet. Age differences. Adolescents are much less likely than older women to receive adequate prenatal care. Women over 35 could be women of multi-gestational, had several babies, or it could be the first time that she's become pregnant. Multifetal pregnancy is an increased risk of adverse outcomes for both mom and fetus. Twin pregnancies can often end in prematurity. I've seen some, I think 36 weeks is the oldest that I saw the twins. Rupture of membranes before term is common. Congenital malformations twice as common in monozygote twins as in singletons, and there's no increase in incidence of congenital anomalies in dizygotic twins. Multifetal pregnancy likelihood increased with one or more of the following factors are noted in the assessment. History of dizygous twins in female lineage, use of fertility drugs, rapid uterine growth for weeks of gestation, and polyhydramnios. So that's in an assessment. If you see any of that, there may be more likelihood that there is a multifetal pregnancy. Multifetal pregnancy likelihood increased with one or more of the following factors are noted in an assessment. You may palpate more than the small or large parts than expected. Asynchronous fetal heartbeats may be heard or more than one fetal electrocardiographic tracing. and also ultrasound evidence that there's more than one fetus. Prenatal care is given to the woman with multifetal pregnancy, includes changes in more frequent visits, the amount of weight that should be gained, the nutritional intake that's needed. So the uterine distension can cause severe backache. Multiple newborns may place a strain on finances, space, workload, a woman and family's ability to cope. Lifestyle changes may be necessary, and there's national organizations that are available to support these women. If you're involved in their care, it would be a good idea to know of the national organizations that are available for their support to give them that information. Prenatal educational goals, assessed individuals and their families to make informed, safe decisions about childbirth. Assist to sort out reliable information from internet's online sources. Assist to comprehend the long-lasting effects on empowering birth experience can have, and ideally this begins in the preconception period. Components of early pregnancy classes: early fetal growth and development, physiological and emotional changes in pregnancy, nutritional needs of the mother and fetus, and environmental and workplace hazards occur with early pregnancy classes. Giving them this information earlier on is important. Components of late pregnancy classes. So when somebody comes to a late pregnancy class, you want to help them with management of discomforts in labor, relaxation techniques, breathing techniques, imagery and visualization techniques. Also, information on pharmacological interventions such as IV medications and epidurals. Prenatal care choices could become from physicians, midwives, certified nurse midwives, direct entry midwives, traditional or lay midwives, and doulas. Doulas, if you work in labor and delivery or you have been in the labor and delivery unit, you may see there are a lot more doulas around in all the hospitals. They have become more and more accepted. That's someone that the patient usually pays to come and help them, support them through the birthing experience. Some hospitals have volunteers that do that as well. Birth setting choices could include hospitals, labor, delivery, recovery after birth, birthing rooms, birth centers, home births. Ensure there's informed consent, informed choice with home births, and the certified nurse midwife attendance greatly improves safety. Chapter 9, Fetal and Maternal Nutrition. So key components of nutritional care is the nutritional assessment, diagnosis of any nutritional related problems or risk factors, and intervening based on an individual's dietary goals and plan for appropriate weight gain. Evaluation with referral to a nutritionist or dietitian as necessary. Socioeconomic status, income needs. Income meets needs for the food, shelter, clothing, health insurance, and Medicaid, nutrition, dietary intake, adequate food supply, make sure there's a good quality, available and affordable, personal, could be genetics, culture, race, ethnicity, language, environmental, could be home, community, exposure to tetragens. Education, knowledge, skills, comprehension, language, perinatal education, family, size, composition, stability, support, availability, self-care, wanted pregnancy program adherence, compliance, and active involvement, collaboration, and the health status, physical, psychological, emotional, health services available, accessibility, acceptable, and affordable. This is all things that need to be taken into account with a patient that is pregnant, really with any patient. Nutritional needs before conception. So the first trimester is crucial for embryonic and fetal organ development. Healthful diet before conception ensures that adequate nutrients are available for a developing fetus. So folate and folic acid intake is very important in the preconceptual period to decrease neural tube defects, which are more common in infants and women with poor folic acid intake. Factors that contribute to increase in nutritional needs: development of the uterine placental fetal unit, increased maternal blood volume and constituents, maternal mammary development, and increased metabolic rate. Energy needs: weight gain, BMI, pattern of weight gain, hazards of restricting adequate weight gain and excessive weight gain, protein, omega-3 fatty acids, fluids, all important, minerals and vitamins such as iron, calcium, fat-soluble vitamins such as vitamin A, D, E, and K, and water-soluble vitamins such as folate, folic acid, pyridoxine, vitamin C, B6, and B12, other minerals and electrolytes such as magnesium, sodium, potassium, zinc, fluoride are all important. Here showing the weeks of gestation and the weight gain. This is an old chart. Other nutritional issues during pregnancy: alcohol, caffeine, artificial sweeteners, pica, and food cravings. Here's a picture of pica. So you have cornstarch, baking soda, laundry starch, ice, looks like clay. Adolescent pregnancy needs. So the nurses work to improve nutritional health of pregnant adolescents by focusing on knowledge and planning of meals, promote access to prenatal care, and develop nutritional interventions and educational programs effective with adolescents. So understand factors that create barriers to change in an adolescent's population, which the barriers are the several things that we talked about earlier around the pregnant woman. Those all could be barriers. Preeclampsia. The cause is still unknown. Speculation is that poor intake of specific nutrients may be a contributing factor. An adequate diet remains the best means of prevention. Adequate diet remains the best means of prevention. And this is across the entire lifespan. Physical activity during pregnancy. So moderate exercise yields many benefits, including improving muscle tone, shortening course of labor, and sense of well-being. Labor is like a marathon. You need to be in shape to be able to get through it. Not saying that not being in shape, people can't get through it, but it does make it a lot easier. I've seen runners that have had babies, they're pregnant, they have the baby, the labor was quick, they're up walking around like they never even had a child. Liberal amounts of fluid should be consumed before, during, and after exercise. Calorie intake should be sufficient to meet the increased needs of the pregnancy as well as the exercise. Nutrition needs during lactation, similar to those during pregnancy. So needs for energy of calories, protein, calcium, iodine, zinc, and B vitamins. C vitamins still remain greater than non-pregnant needs, especially during lactation. You're burning like 3,500 calories a day. You want to make sure you're intaking enough. Energy intake increases to 330 kcals more than a woman that's non-pregnant. Intake recommended. Increased maternal weight loss during lactation. Seen it all the time. Smoking, alcohol intake, and exercise caffeine intake should be avoided during lactation. So smoking, alcohol intake, and excessive caffeine should be avoided during lactation because you're just giving that to your baby. Obstetric and gynecological effects on nutrition. Multiparous women have frequent pregnancy, a history of preterm or low birth weight infants, a history of large gestational age infants, conception choices. These are all effects on nutrition. Health history, chronic health conditions, usual maternal diet, finances, financial status, and nutritional knowledge can also affect nutrition. Body measurements such as weight, height, and BMI. Lab testing will test your hemoglobin and hematocrit. On physical assessment, nutritional care, and teaching, so generally involves components of adequate diet, individualizing the diet to the needs, culture, and finances of the patient, coping with nutritional related discomforts, use nutritional supplements when appropriate, and consult with or refer to other professionals as needed. Adequate dietary intakes, it can be found on the DHHS and USDA. They develop the most recent guidelines. So pregnancy, most women must understand an adequate weight gain. After birth, the goal is to lose weight gained during pregnancy, but you must ensure proper nutrients are maintained, specific calorie and nutritional needs for lactation. Lactation and body weight, those who gain more weight than recommended have a lower breastfeeding rates, and obese women who breastfeed often do so for less time than normal weight women. Weight loss if lactating is slower than non-lactating women. Daily food guide and menu planning. Medical nutrition therapy, iron supplementation may be needed. Nutritional related discomforts include nausea, vomiting, constipation, pyrosis, cultural influence, and vegan diets. Chapter 10, Assessment of High-Risk Pregnancy. Biophysical risk, factors that originate when the mother or fetus and affect the development of functioning of either one or both. Psychosocial risk include maternal behaviors and adverse lifestyle, and sociodemographic risk arise from the mother and her family. There's environmental risk as well. Psychologic considerations. Label of a high-risk pregnancy may result in an increased sense of vulnerability, stress related to that diagnosis, ambivalence regarding the pregnancy, inability to accomplish the task of parenthood, and fear for well-being of the mother. Daily fetal movement counts is very important. Kick counts is what they call them. Simple yet valuable method to evaluate the condition of the fetus. So there's several methods that are used to count. So once a day for 60 minutes, 2 to 3 times daily, or 10 movements should happen within a 12-hour period. At the hospital, once a patient comes in for her fetal monitoring while she is probably like 30 some weeks, she gets checked with her fetal monitoring, or she may be seen more often due to high risk, and we will send them home with kick counts. So making sure that she feels 10 movements in a 12-hour period. Ultrasound indications for use could be fetal heart rate activity, gestational age, to detect fetal growth, fetal anatomy, for fetal genetic disorders, physical anomalies such as missing kidney, placental position and function, make sure that the placenta is in the right place and not over the cervix, which could be previa. Adjunct to other invasive tests. So indications for use of the ultrasound could be for fetal well-being, so Doppler blood flow analysis, amniotic fluid volume, the biophysical profile, or modified biophysical profile. Nursing role is to counsel and educate about the procedure, and non-medical ultrasounds such as the 3D and 4D images, the ACOG, which is the American College of Obstetrics and Gynecology, strongly disagree with those. Here's some picture of those, 3D and 4D. Here's a picture of the side of a fetus. You can see where the nose is in the back of the head. Amniocentesis can cause maternal complications such as hemorrhage, fetal-maternal hemorrhage, infection, cause labor, can cause abrupto placentae, damage to intestines or bladder, and amniotic fluid embolism. Here's amniocentesis. So they take the needle over here. You can see, let's see if I can do this again. Here's the mom. Okay, so they take the needle and go past the uterus into the amniotic cavity. Here's another picture of it here. Send that into the centrifuge, and then they'll do some testing. Fetal complications can include, with amniocentesis, can include fetal death, hemorrhage, infection called amnionitis, injury from the needle, and risk may be minimized by using ultrasound to direct the procedure. Indications for use could be genetic concerns with a woman that's over 35 years old or that has a family history of chromosomal abnormalities. Fetal maturity, LS and SA ratios. Chorionic villus sampling, earlier diagnosis and rapid results is performed between 10 and 13 weeks of gestation, and it's removal of a small tissue speculum from the fetal portion of the placenta. The chorionic villi originate in zygote. The tissue reflects genetic makeup of the fetus. Here's a picture. Yep, here's a picture of that. So the instrument is injected to the fetus side of the placenta. It's done with ultrasound. And here's the amniocentesis when it's done with the ultrasound. So it would probably go down just a little bit more to where the amniotic fluid is. This looks like it's almost there. Maternal assays, the alpha-fetoprotein, so the maternal serum levels are screened for neural tube defects. It's 80 to 85% to open neural tube defects, and abdominal wall defects can be detected early. It's recommended for all pregnant women. Alpha-fetoprotein. Indications would include varies with gestational age. The goal is to determine if the intrauterine environment is supportive for the fetus. Non-stress test, fetal activity determination. It's a procedure. It's interpreted. Vibroacoustic stimulation. Here's a picture of a fetal strip. Here's another one. So the top strip. Gosh, I wish I was in class to show you guys this. The top strip. Oops, let me go back. There it is. Okay, the top strip. So you see where it says 120, that's the fetal heart rate. It's between 120 and 130. So I would say it's running about 130 for the heart rate. Down here is going to show me if there's any contractions, and really there's not much movement. I wouldn't say there's any contractions going on in this picture, but if you have a contraction here to here, you're going to start at the beginning of this one to the beginning of, I'll have to show you no different because I can't show you any contractions here, which does not, I'll show you probably in the coming weeks how to read a strip, but I can tell you that the heart rate is around 130. Here's a change in the heart rate. Usually happens after a couple minutes of staying accelerated. So right here, I would say it's about like 125, jumps up to 150, 155. This may be an inverted contraction. Contractual stress test is a procedural Can be done by nipple stimulation to cause contractions. Oxytocin stimulation. This is done when the mother is getting ready to have the baby. This is not done prior to non-stress test. This is a contraction stress test. So this is done when we're trying to see if she's going to actually go into labor. So nipple stimulation can be done to cause contractions, and then oxytocin or pitocin is given. It gives you an interpretation and provides a warning of fetal compromise earlier than a non-stress test. Careful monitoring throughout the pregnancy. Women may feel stressed related to a diagnosis of may have low self-esteem, guilt, frustration, may alter their ability to attach to their fetus, and the nurse should provide encouragement and support during the high-risk pregnancy. There we go. Okay, so now we have some good strips. This one, that's 120. It's probably 130, 145. Has some variables. We call these variables if it's like a sharp up and down. Acceleration here. An acceleration after 35 weeks should be up 15 and across 15. So it looks like the heart rate went up at least 15 beats and at least 15. So these are all 5, 10, 15, 20. I'm sorry, they're 10, 20, 30, 40, 50, 60. Each one of these boxes to this box is 60 seconds. Here is contractions. So you'll start where it goes up here. So that's 1. You start over here about right between 10 and 20, so about 10. So you'd say 1 minute, 2 minutes, 3 minutes, 4 minutes, and then you have 1 and a half to 4 minutes. So the heart rate's 145 and contractions are 1.5 to 4 minutes. Here, and there's good variability. You want moderate variability. So you want the heart rate to go up and down, up and down. And you want it to go up at least 10 to, between up to 25 for moderate. This looks like a crappy strip. You have some decelerations, so the heart rate decreases after a contraction. That shouldn't happen, it should increase. Heart rate decreases after a contraction. And if you look at this heart rate, it's pretty flat. My baby's not very happy, not doing very good. So here is, we'll start here. 1, 2 minutes, and then we have 1, 2 minutes, about every 2 minutes for the contractions there. Oh, I'm done with that chapter. Let me click off this. I think that was chapter 10. We'll go further into the strips later because, yeah, that's chapter 10. So I expect you guys to read the ATI. So we went over chapter 7 through 10 from the book. You'll need to read over ATI, which goes probably more into depth with this. It's the 3, 4, 5, 6, 7, 8, and 9. Test will be next week. Let me look. Your test is next week. I will put up some information about the test. I will tell you that we do test with ATI. So make sure you read over your ATI, understand your ATI. I'm going to probably put up a couple videos that I can find for chapter 7 through 10 to kind of pull everything together, do all your reading. And the test will be 50 questions over the material that we've gone over. All right, you guys have a good night.